This video is going to be a knee evaluation. My name is Stephanie. I'm the athletic trainer. What is your name, sir?
My name is Don.
Don. All right, what brings you in today?
When I run for the past 3 weeks, when I've been running, during and after my runs, my knee's just been causing me a lot of pain.
All right, can you point to where your pain is going?
It's like right here on the bottom side of my knee.
Okay. Do you have any pain that runs down, or do you feel it up here?
Mostly below the knee.
Okay. So you said during and after activity. All right, I'm just going to touch your knee if that's okay. Is that painful?
No.
Okay. Have you been treating it at all?
Just ice sometimes.
Good. Okay. Have you ever had any history of injury to this knee before?
Yes, I dislocated and tore my patellar tendon.
Okay. So when he says I have a couple differentials that I can immediately think of, patellofemoral stress syndrome, patellar tendinitis, patella baja, which would cause him to, or alta, which would cause him to dislocate. He could be having weakness in ligaments in his knee, which can cause that discomfort when running. But because of where he's pointing to the pain, I am going to think that his pain at the inferior pole of the patella and along the patellar tendon is going to be patellar tendinitis. Another differential with this point tenderness could also be Osgood-Schlatter's. I don't see any deformity along the patella like Osgood-Schlatter's would show, although he does have inflammation and pain. So if Osgood-Schlatter's is developing, that could certainly be the case. However, because he is running, they're 3 weeks into the season, this is pretty normal with runners and jumpers to, once they start their season, to start having that inflammation and pain from the tendinitis. I'm just going to do some tests on you really quick to see if you have any structural things going on. As of right now, I think it's patellar tendinitis. Okay, so I'm going to put some pressure on your patella downward. Slowly contract your quad. It's going to be painful if you do it quickly, okay? Relax. Relax. Slowly contract your quad. Is that painful? No. I feel a tiny bit of crepitus, but normal for someone who has a history of a patellar dislocation. In addition, he is feeling tightness in his legs, which could be a sign of Osgood-Schlatter's or just someone who is fatigued. So it is leading me toward questioning if it is Osgood-Schlatter's or patellar tendinitis. One thing that we can do from here on out, we can continue to monitor it and see where his pain is and if he is having any deformities develop. I am going to palpate him and see if there is anything noticeable. He has some swelling in there. Okay, so when I palpate his knee, he does have some swelling in there. Something about the swelling is that it's pretty normal. It's not like a bursitis or something that would cause me to be concerned. It is something that looks normal with the amount of swelling for patellar tendinitis. I only felt crepitus when I pushed down the patella and have him contract his quad. He has normal range of motion for patella. He just says he's point tender along his patellar tendon. So if I feel along the tibial tuberosity, any pain here? Okay, he does have some swelling, but not any pain. So that leads me to kind of almost want to rule out Osgood-Schlatter's because they would have pain into tibial tuberosity. If I do squeeze test, any pain here? Any pain here? And if I were to do a percussion test, it would be negative. Obviously, if I put a tuning fork on tibia, and fibula, and femur, and patella, they would all be negative. When they have point tenderness on the patella, it is important to consider a patellar fracture. However, his mechanism of injury is chronic overuse from running. So I'm not going to consider that as a differential. But it definitely crossed my mind when he said point tenderness over the patella. So with patellar femoral stress syndrome, I think that is something that can definitely occur if we don't take care of this. But as of right now, I think this is patellar tendinitis just because he's a runner and he's overusing, obviously, his patellar tendon is absorbing that force from that constant pounding as he's running. From here on out, we can just manage pain. We can help the inflammation by adding ice. Icing the injured area will help speed up the metabolism. It won't stop the swelling from happening, but it will slow the metabolism process. So before practice, you can have him come in here. We can do a little strap over the patellar tendon. Hopefully that'll help with pain. There's rice for rehab. Definitely want to stretch if he is tight. That could be causing some of his pain. If he's having tight quads or tight hamstrings. He is also someone that is predisposed to knee injuries with his history of them. And that is something that we need to be careful of as we move forward in the rehab process. But as for today, I'm going to, for my short-term goals, I'll just ice him and ask him to come in tomorrow, see how he's feeling before practice. Do a strap around his patellar tendon, and hopefully that relieves some pain during activity, and hopefully he won't have pain after activity, or not as much. We'll see how his swelling is doing, and if there's any deformity that presents
on the same level as me?
As he continues through the season, then we should consider allergen spotters. All right.
Oh, he just ran through my build, no way.
Thank you.